Hey, thanks for coming back and grinding out with those meds with me. I'm Nurse Nick. I'm a pharmacology instructor, American Heart Association ACLS and PALS instructor, and also emergency department nurse. Today we're going to be talking about the pharmacology chemo drugs, all right? Chemo, they're going to treat cancer drugs, right? So the first 3 or 4 videos is going to be divided into 2 different segments, and now we'll make one full complete video with the quick and dirty information of each one of these drugs that you want to consider. But first, when we talk about cancer, you're going to ask yourself, what is cancer? Understand what the diagnosis is, right? So this is where you have uncontrolled cellular division. Well, a lot of these cancer drugs work, a couple of different ways that they work is one that they're going to attack how the cells divide and replicate, because there's a problem with mitosis in the division, so it's going to attack highly dividing cells. So some adverse effects of chemo drugs are going to be stomatitis. You guys heard about that yet? What is stomatitis? You should pause and look it up. So it's got the appearance of like canker sores that happen in your mouth, red. It kind of makes sense, right? Because your endothelial cells are going to be your highly replicating cells in your mouth, down your GI tract. So it can cause irritation, called stomatitis or mucositis, where you can have this redness or inflammation, irritation in your mouth. But also, some cancer drugs are going to compete with some hormones, okay? So with like breast cancer, estrogen is going to be competed with some of the chemo drugs. But if you think about with men, what's the hormone that they're probably going to have with like, testicular cancer or prostate cancer? And it's probably going to bind with testosterone. Well, start expanding on that. Where have you heard about estrogen before? Why do a lot of women usually take estrogen pills? They're contraceptives, okay? With contraceptives, what are your risks that we all know that you have, right? With extra estrogen, it puts you at risk for having breast cancer, right? So it makes sense that a breast cancer chemo drug actually competes for binding of estrogen, all right? So some of these chemo drugs are going to compete with the binding of the hormone, and some of them are actually going to work on the division, rapid division of the cells. So everything with all of these drugs that remember pharmacology, generally you're just going to have to remember 1 or 2 things, considerations, but of course some medications are going to have a handful of things, like your steroids, your nitro. There's small novels written on them. So let's get started with chemo drugs. The first one, interferon A, or Intron A. This medication is a cancer drug, but what makes this one unique is it also treats viral infections. It also treats hepatitis, all right? So when I think this one, if we're going to really separate all these cancer drugs out or oncology drugs out, this one works on treating the viral infections. If it treats a viral infection, it makes sense that I also remember this one causes flu-like symptoms, right? So you can have the fever, muscle aches, chills, lethargy, and a lot of these drugs are going to cause bone marrow suppression. Let's start hitting these things. Bone marrow suppression, it's going to decrease the blood cells that your body makes. What should I be checking? Probably a CBC, complete blood count. What are my ranges? I know there's variability that ranges depending on what your program is. But I'm going to tell you, I always remember white blood cells, 5 to 10,000. And then you got your red blood cells. So I always just remember the hemoglobin and hematocrit. Which one's the most important identifier if you need to have blood? It's going to be your hemoglobin, right? So the book says, I think 12 to 16 for female hemoglobin, and then 14 to 18 for men. I just tell you to remember hemoglobin is a straight range from 12 to 18. And then your hematocrit. Your hematocrit's going to be different for women, females, and males as well, because usually females are smaller bodied. Your hematocrit's going to be 37 to 45%, and for males, 45 to 55%. Just remember the number in the middle, because these ranges are ridiculous and hard to remember. Hemoglobin, 12 to 18. Hematocrit, 45%, right in the middle. And the next, if you want to remember your platelets, you should remember your platelets. What are your platelets responsible for? Clotting, right? Cut my arm, my platelets are too low, I'm going to bleed. So your platelet range is going to be 150,000 to 400,000. So back to the chemo drugs. Bone marrow suppression, check your CBC, know your numbers. NCLEX, if you know your results, you're going to be getting the stuff right anyway. Interferon alpha, or Intron A, this medication can treat cancer or viral infections, and it has many flu-like symptoms as adverse effects. So the next medication is tamoxifen. Tamoxifen treats breast cancer, all right? So again, when I talked about breast cancer, if it's prostate cancer, tamoxifen treats breast cancer, and this one competes with the estrogen for binding sites for breasts. It stops growth of estrogen-dependent cancer, and this medication, it makes sense. What happens to women when they go through menopause and estrogen changes? It causes hot flashes, right? So it's obviously a consideration with this medication that can cause that. This also causes hypercalcemia. What's your calcium range? 9 to 10.5, or I've seen some literature 8.5 to 10, just know whichever one you want to do. But this also increases the risk of endometrial cancer and pulmonary embolism. So watch out for those things. It's kind of funny, so tamoxifen, I had a student in my class, her name was Tammy, and she lets me always talk about this. She actually came in one of my other classes and introduced herself, because I teach tamoxifen. If you knew Tammy, you always have those classes where the girls are a little bit saying funny things, but she's always like, I'm just going to remember tamoxifen by saying Tammy's boobs. Like, I'm not trying to get out of control. Whatever helps you remember these drugs, do it. Because with pharmacology, it's about memorization, okay? Tamoxifen treats breast cancer. So the next medication we're going to talk about is going to be Lupron. It's going to be the final medication for this video. You're going to get another one. So Lupron is also Lupron. This medication treats prostate cancer. So guess what? Prostate cancer, guys, this decreases testosterone from the testes. So what are adverse effects of decreased testosterone? This is going to be gynecomastia. What's gynecomastia? You know, we need to stay mature about it, but gynecomastia is man boobs, and it can cause bone loss and decrease libido. It makes sense. Erectile dysfunction. This is a big problem for men, right? So increase your calcium levels, increase your vitamin D intake. Anybody with the concern of osteoporosis or bone disorders, increase your calcium and vitamin D. But monitor your PSA level. You should know that your PSA level is huge for prostate conditions, because your PSA level is your prostate stimulating antigen. That's how we identify that you have enlarged prostate or prostate problems, or BPH. What is BPH? Benign prostatic hyperplasia. All these things fit in together. Just take them all in and try to understand how to, merge them. So I'm Nurse Nick. That's the first sequence of the chemo drugs. Stick around for video 2, like and follow, and we got more pharm coming. Thanks.